Dr. Srinivas, it's great to have you back. Thanks for sparing your time amidst your busy schedule.
My pleasure. Thanks a lot for having me.
Okay. Just to remind audience and the viewers that we covered a lot of kidney stones and UTI the last time. That was in great detail. So today I'm going to go a little into the basics of what a kidney is, what is a kidney dysfunction, and what is an utter failure, and what are the options beyond that. So first question, Dr. Srinivas, what does the kidney actually do day to day, and why is it critical to our overall health?
As we know, in a very sort of a very simplified way, we say kidney is an organ which cleans the blood. Okay, no, which cleans the body, which cleans the blood. So it cleans the blood of all the metabolic waste products, all the organic, inorganic waste have to be thrown out of the body, and it is thrown in a very sophisticated way. It has to be thrown out without affecting any part of the body. So it does, work in cleaning the blood. But at the same time, it does it in such a phenomenal way that it also has a very significant role in body's fluid management and electrolyte management. Whenever there's a loss of electrolytes in some other part of the body, either by sweating or by breathing or loss of fluid in some other part of the body, the kidney compensates for it. But kidney is like a fluid regulating mechanism of the body. The kidney is also an electrolyte regulating mechanism of the kidney, like sodium, potassium, fluoride, and even calcium. All the metabolism is taken care by the kidney.
Got it. And when you say it cleans the blood and then the fluid management, so what causes these blood to have this metabolic waste? And what happens if it's not cleaned?
See, the thing is, body is a very dynamic, organ. Body is a very dynamic thing. So for the unit to function well, for it to carry out its dynamic function, kidney has to do its job. For example, it may be breathing, it may be muscular exercise, it may be food intake. A lot of things, there's a lot of exchange between the nature and the body. So body goes through, one is loss of fluid, loss of heat, so many things. So in order for the body to carry out those functions, kidney has to be there as a backup. So okay, it's called as homeostasis. When we say homeostasis, body has to maintain temperature, the fluid, the electrolytes, the blood content. For everything, kidney has a role. Kidney also has a role in hemoglobin production. Kidney is an organ for hemoglobin production. Kidney also has a role in vitamin D synthesis and calcium metabolism, because kidney is an organ
Wow.
which produces vitamin D. Kidney is an organ which also helps in production of hemoglobin. That's why people with kidney disease will have low hemoglobin, because
Interesting.
kidney is involved in all this. Yeah, yeah.
This is very fascinating and new to me. So I didn't know that kidney was involved in hemoglobin plus vitamin D and calcium synthesis or generation.
Yes, please. Yes, please.
Wow. Okay. Great. I think this
So
gives us a
it,
lot
it,
of.
it does it does it does a job as if it's an endocrine organ, as if it is like any of your, like for example how testes produces testosterone or adrenal produces steroids. Like their kidney produces vitamin D, one vital step of vitamin D synthesis. Kidney also produces erythropoietin, that is hemoglobin production, RBC production.
Got it.
Kidney is involved in all this.
Okay. So I think all of us have two kidneys, but I've generally heard that people can live with one kidney. How does it work? Like, does it mean we can use 50% of our kidney capacities all the time? How does it? How does the body regulate which kidney to use, and how does that physiology work?
See, actually, you know what? Actually, you said no. You very rightly put out this confusion about the kidney, because the kidneys are such wonderful organs. They create this confusion, for example, because of their efficiency. Because, for example, whenever we say a kidney, no, a kidney, when we say no filtration and production of things, the kidney, which is probably, say, assume around 10 into 2, 10 into 5 centimeter, approximately that's the dimension that we describe, for an adult man. So that whole unit, the whole kidney is made up of at least 1.5 million nephrons. When we say nephrons, nephrons are the functional units which produces the urine. So they're like, you can just imagine like very tiny filters. The whole kidney is filled with multiple tiny filters, and the number is approximately, is what estimation is, around 1.5 million nephrons. Interestingly, it's just like the lungs only. Not every aspect of the lung is fully used throughout your day, throughout your life. Same thing in kidney also. Not every aspect of your kidney is fully used during its day-to-day functioning, because the kidney unknowingly, it's really very strange mystery of nature. The kidney has such huge vast reserve. So that is why the reserve is there. It has two things. One is it is an advantage also that it can use up the reserve whenever it wants. It's also a problem because whenever there's a kidney dysfunction, some part of the kidney is damaged, it will not even raise an alarm because the reserve takes over the function. So the kidney never warns you till the reserve is over, and then you have nothing left, not to save yourself, because it gives you so much reserve initially. So that's why people donate kidneys. One is people are born with kidneys, which is only one kidney, and people also donate kidneys. Donating kidney is also legally valid because even if you donate one kidney is more than enough for you to lead a normal life, a very normal, perfect life, because that opposite kidney does all the job.
This
So that's
seems to be a blessing and a disguise in one package.
yeah, 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 exactly.
So, in a normal person like us who have two kidneys, how does the brain or the body decide? Okay, today I'll use left one, today I'll use right one, or I'll lose 25% here, 40% there. I just want to get an understanding of what percentage of our kidney actual capacity is used on average for a normal person, adult, and how does it decide which one to use?
See, the thing is, the entire kidney is always, kept in function throughout one's life. Okay, no, so that's not a problem unless there's a disease. Unless there is some disease process which affects a specific part of the kidney still works, no problem. But the point is, like for example, whenever the temporary one kidney obstruction, temporary blockage because of something, opposite kidney starts taking over all the function. Because of there's a hormone which both the kidneys share between them. So there's always like not just kidneys for that matter, every organ in the body has a crosstalk with the other part of the body because they always talk to each other about what's happening, like how are the resources being used up. So the kidneys also have a crosstalk through a chemical. Okay, no, through this chemical we come to know one kidney comes to know that his fellow is not doing his job. So this kidney takes over all the functions because the solute load, everything will tell the opposite kidney that it has to do all the job. It starts taking over gradually from the opposite kidney. If the fellow kidney we're talking has some problem, either a blockage or infection or some tumor or something is sitting there, so that kidney does. Otherwise, if there's no disease as such, both of them do a fairly equal job. But again, when we say equal, they are not exactly equal. It will be like either 55, 45 or 50, no, 58 and 62. I mean, 48, like that. So they take over the job in such a way the total function is 100%. But the difference is generally we say is not more than 65, 35 like that. And that's the max. Otherwise, if the difference is more, means one kidney can clearly be said as a weak kidney. But
Ah,
usually, yeah, yeah. Usually, when both the kidneys are normal kidneys, when we're talking about, it's almost like 50-50. But yeah, it's never exactly 50-50 because one kidney is always better than the other.
got it. And just for our knowledge, what's this chemical signaling called between these two kidneys?
See, there are actually multiple levels. One is called as ENP, atrial natriuretic peptide, BNP, brain natriuretic peptide. All these are chemicals which are produced by the kidney itself, and which are thrown out by the fellow kidney. But the thing is, when the chemical accumulates beyond a point, the opposite kidney does all the work. That's how the signal happens.
Hmm.
And that's why we also say kidney is involved in a hormone which is meant for BP regulation. Even the blood pressure regulation is also done by the kidney. So kidney produces these chemicals called as renin and angiotensin. That's why somebody with a kidney disease can have hypertension, and that
Wow,
hypertension can be horrible hypertension which can't be managed with normal BP drugs. So because if the kidney is under dysfunction, this number goes up, and there's a high blood pressure. So because kidney is involved in regulation of blood pressure also.
got it. Uh, So this seems more intricate than what I think general population actually believes, that it helps in clearing waste and helps you pass urine. That is
Yeah.
all we remember, but looks like it does a lot more than what
So,
one can
so,
fathom.
so
Quite quite fascinating. So
that's why we
one of
always say kidneys are extremely intelligent organs. They're so
yeah,
intelligent organs. They're like multitaskers. They do multitasking, and they're very efficient. At what they do. Because even to because people have tried to mimic the kidney function in the artificial lab setup, they cannot prepare a machine which can do what the kidney does. Humans have tried it actually,
okay.
artificial kidney, but it's such a wonderful organ.
But then I thought people tried artificial different parts of the body as well, right? Like other parts work to an extent. I
Yes.
mean, how's the science in that?
Same. See, most organs, like what nature has designed. are wonderful only. I mean, no doubt about that. But when it comes to the complexity, the number of things kidney does at a given time. It's not just filtering and not just clearing the fluid out of the body because
Mhm.
it has done it at multiple levels. So not easy to mimic the kidney. They've done that, but not been so successful. Otherwise, you don't need a kidney transplant, is it? You can use the artificial kidney machine and live a normal life. So that's why
That's true.
this kidney organ donation is such a great thing. People have to donate kidneys because the kidney is produced by nature. So you cannot get it in the market. How much the black market? You cannot get it.
I'm just quite curious now. So when we go to bed, a lot of our organs go to rest, is what I believe. But for brain, which is reasonably active, does the kidney remain active throughout the day, or does it have any rest time when you sleep? Is there any data around that?
No, interestingly, not just the brain. You know what? 99%, most of the vital organs in the body do not take rest. You know, your heart never ever stops. It works throughout the day. Night also same. Morning also same. Lungs also same. Liver works. Kidney works. None of the vital organs go to rest at night.
Hmm.
What is the thing that only goes to rest at night is the superficial part of the brain. Deeper part of the brain still works 24 hours. Only the superficial conscious part of the brain doesn't work. That's all. So throughout night, all these organs work. But interestingly, in order for you to accommodate your sleep so that your sleep is not disturbed, the kidney regulates itself in such a way that the nighttime urine production slowly, comes down. Comes down so that your sleep is not disturbed. So that we want that organism to take rest. Therefore, the urine output is there, but is reduced. That's why when the kidney doesn't do its nice reduction of output, it can be disturbing factor for some people.
So does that mean kidney aligns with the circadian rhythm in some form?
Perfectly, perfectly. Because the whole circulation, adjusts to the body. For example, when you're standing upright, most of the body is upright and the kidney is in the second lower portion. The kidney may not get adequate liquid. When you lie down flat, the entire body's fluid comes to the mainstream circulation. So the kidney is at the back. That also gets adequate, blood circulation and the output, the clearance may happen better. But still, that will not show up in the variation in the urine output. It only reduces because of the to reduce the number of visits to the washroom so that the body can sleep efficiently.
Now that we have identified that kidney is more intelligent than what I and everybody thought, or most of them thought, I just want to understand, if let's say someone has one kidney and the entire body and the communication mechanism is wired, that there are two kidneys that are operating, and this ALP1, BLP, etc., are talking to each other and figuring out what is functioning, what is not functioning, what kind of percentage you're operating at, etc. And suddenly he becomes a one kidney man or a woman. How does the brain in particular and the body adapt to this new change in physiology?
See, the thing is actually the adjustment all happens at the kidney level itself. Because it happens at the kidney level, the entire body need not do any modifications. It's all about the kidney level because it's like the two kidneys are like one house. Ultimately, somebody has to do the whole job. So whether husband does it, wife does it, or what, it doesn't matter. Ultimately, the job should get done. If one person cannot do it, other person should do it. Ultimately, the output has to come. So one person is doing 90% of the job, other person is doing only 10% of the job. Doesn't matter. So because the entire body works efficiently because these two have a nice understanding. If one kidney is fully taken over, opposite kidney does all the job. So it happens at the kidney level itself. And yes, you're right. The opposite kidney, if it is a perfect normal kidney, the moment you take out the kidney, this interesting thing, whenever you do, this kidney removal for a donor who's donating kidney to his loved one, somebody, we remove the kidney. Within 1 hour, you see the opposite kidney does all the job. Within 1 hour, you see the urine output to be normal because the opposite kidney takes over all the functions without any rhyme or reason. It just takes over function. So that is the wonderful thing about the body.
Very fascinating. One of the things that you mentioned a while back is this 1.5 million neurons per kidney. I believe that to be the number. Now,
Yes, please.
and we also discussed the blessing and the disguise part, where if there is some dysfunction and it's kind of happening, and the kidney kind of doesn't scream out that I'm actually having some problem, and you won't come to know. But at what stage does anyone come to know that there is a kidney damage, and particularly when it is irreversible and there is point of no return?
See, the thing is, whenever we talk about the kidney disease or native kidney disease, It depends on what kind of native kidneys we're talking about. There are some kidney diseases which start giving signs, a bit early only. But most kidney diseases won't tell you unless the disease itself is, for example, there's some infection, some inflammation, some blockage, some tumor. They will tell you indirectly. But if it's an intrinsic native kidney dysfunction because of some genetic issue or some toxins or some infection, so they're so subtle that you'll not come to know until it's too late. So some of the signs we say, again, these are not very reliable, are, frequent urination, sometimes waking up in the night, sometimes frothing of the urine, sometimes mild blood in the urine, and sometimes, only simple urine test telling us about proteins in the urine. They are all indirect signs to say that, there's a kidney dysfunction. But interestingly, many of these turn out to be false signs also because many patients come too early, they get confused. They say, sir, I'm seeing frothing, but if you check, actually nothing will be there. Or frequent urination and so many things. But yes, these are the only subtle signs. There's no other sign to know.
So, but if the signs are so subtle, at what stage do you then diagnose that the kidney has suffered severe damage?
See, I'll tell you what, the only way is severe damage is very obvious. The patient suddenly starts saying lethargy, tiredness, urine output reduction, and so many other problems. Patient will obviously come to you. But the only other way to know, for example, if at all you have to warn people is, people with comorbidities in the form of, diabetes, hypertension, or smoking, or any drug history, their background should be checked up. They are the people who belong to this high risk category, or people, who don't drink enough water for some reason. There's a reason some people, they don't drink. So they're all people who are on the edge. So we need to screen them very frequently. And people with, family history of medical diseases, where, family, there's something in the parents. So they are all the high risk people. Okay. So we need to screen them a bit early. Like, nothing better than annual health checkup or something for that. So they badly need it.
So the pelvic or ultrascan, does that give some kind of an
See,
indication along with
ultrasound
the
scan,
urine?
ultrasound scan is sometimes deceptive because ultrasound scan may not always detect. The only thing that will detect is some urine test and some blood test. Ultrasound scan, the kidneys may mechanically look, perfect and healthy. Okay, no, yeah, physically they may look, quite healthy, but functionally they might have already become weak. Ultrasound can detect these changes, but yes, they are not the reliable parameter to assess the kidney.
Okay, interesting. What are the topmost reasons for kidney failure? Like, is there age, gender, lifestyle factors? You mentioned about, let's say, smoking or genetic factors, etc.
Diabetes is the commonest. Diabetes uncontrolled, not taken care for like years together. Once the kidney starts failing, then whatever diabetes you take care of is of no use because kidneys have failed already. So diabetes may be controlled, you can gain back the control, but the kidneys are lost forever. So
Wow.
that is one about diabetes. Okay, the next commonest thing is hypertension. Again, not well controlled hypertension can be due to so many things, including brain problem injury also, plus kidney injury also. Okay, no. And then some children, some people are born with inborn error of the urinary system. The drainage is affected. In those people also, the kidney will go into gradual dysfunction. It's called as reflux kidney disease, where the urine flows in the opposite direction.
Oh,
So that also can cause kidney dysfunction. But they're all children, and you already have telltale signs. Parents who have already had an encounter with the medical, specialty. So they're supposed to go back and check back with the doctor and those kind of things. But otherwise, toxins can cause, exposure to, some food products, infection, and smoking, of course, can also cause. It's not direct things, indirectly it can affect the kidney function.
it's interesting that you mentioned smoking twice, but no alcohol.
Yeah, alcohol directly doesn't cause kidney dysfunction. Maybe alcohol, the brunt is taken by the liver, not by the kidneys. It doesn't cause.
I noticed that part. So this is very interesting because that doesn't seem to be a very clear signal that the kidney is actually deteriorating or going to go kaput. Uh, so when people come to you with different stages of, let's say, failures or dysfunctions, at what stage, like, are there any grades like cancer 1, 2, 3? Are there any kidney failure stages or anything that they come to you? What's the common stage at which people come to you?
So generally, when we say kidney disease, no, it's basically classified as CKD, chronic kidney disease. So they're all very subtle signs. This number called as creatine. Creatine is a number that is a very sensitive number compared to blood urea nitrogen. Creatine is a very sensitive number. So though the lab range, that's also interesting. Though the lab range says that for example, 0.7 to 1.3 is the limit for the kidney function. Anything more than 1.3 is considered as kidney dysfunction. Okay, no. So even though the lab range is 1.3 and the person's kidney number is coming to 1.25 or 1.3, we already say it's already stage 1 because it's already on the edge. Ideal kidney, the number should be less than 1. So it's already a sign that there's a stage 1 kidney dysfunction. So and then again beyond number wise, it goes to stage 1, stage 2, stage 3. When we say almost stage 4 or stage 5, means this patient requires dialysis because the native kidneys themselves are not able to sustain normal function. The patient may have to be subjected to dialysis shortly. We must prepare them for that or for kidney transplant if at all is possible.
Those are the only two options. There's nothing else
Yes,
that they can do.
yes, yes.
So I'm just curious with all the God's creation of this body. Usually, some issues like even heart issues or liver issues end up showing on the skin, hair, etc. Is there anything visible that a kidney dysfunction shows in the urine, apart from the creatine number in the skin, energy levels, that signals that a person at home can potentially kind of start thinking that hey, something could be wrong with me?
Yes, you're right, exactly right. The same thing applies to kidney also. You can make out in the person's breath the way he breathes, or the skin color, or his tiredness, his ability, his energy to do day-to-day functions. You'll start seeing a deterioration in all this. And many people actually can't make out. Many people only make out by these 30 signs only. When they go to a doctor saying, either he's waking up too often at night, or he's breathless, or he's not able to carry out his normal day-to-day function because they are very indirect signs, no subtle signs you can make out.
Got it. I remember reading that even nails end up showing the
Yes,
dysfunction.
yes,
I forgot the name, Terry's nails or one of I forgot what it is,
yes,
but
yes.
something around that, right? It
Very
shows
true,
some.
very true, very true. All nails also start changes of clubbing. It's called as clubbing. It also starts
Clubbing,
showing
yeah.
signs of, yeah, it shows signs of low oxygen because the blood is already not being clean, no. So the oxygen carrying capacity starts coming down. That's why the people feel breathless. Fluid accumulation in the body, lungs also starts accumulating fluid. All those are subtle signs.
Got it. And you mentioned something very interesting about that frothy or foamy urine.
Yeah, yeah.
Why does it happen, and why is it a red flag?
See, it already means there's a protein leak. See, normally, no, kidneys are such wonderful organs. They will not easily leak protein or glucose in the urine. So they're supposed to be, sort of guarded very well because whenever blood
Hmm.
flows to the kidney, blood not only takes waste product, blood also takes all the vital things with it whenever it goes to kidney. So kidneys are supposed to throw out only these unwanted things, not the wanted things. The wanted things are supposed to be preserved well, and come back, they are supposed to transport it back out of the kidney. But whenever the kidneys are diseased, then this protein starts leaking. Protein starts leaking, glucose starts leaking. Especially when protein starts leaking, you start seeing these changes in the urine, physical appearance, like clotting of urine. So that's a sign. Yeah,
Interesting, interesting. So, if I understand right, the blood carries protein, glucose, etc., so that the cells could repair and maintain their function. Is that
yeah.
the like
Yes,
normal
yes,
reason of how it goes to every part of
yes,
the body, right?
yes, yes,
But then the cells are so damaged or the nephrons are damaged that it can't utilize them and it gets leaked.
yes.
Is that what happens?
Exactly, exactly, exactly.
Okay. So people should watch out for frothy urine. And
Yes.
this kind of tells me that you also mentioned about creatine. So I'll go a little bit into the blood test, which most people do on a very regular basis. What are the key markers in a blood test or let's say slash urine test that people should be looking to ascertain if their kidney is in good health or not?
See, the primary test is the blood test, which is the creatinine. Creatinine is a very strong indicator of all the tests. There are other blood tests also, there are urine tests also, but compared to all of this, the most reliable is the creatinine, which is It's like we can fully believe on that and say, yes, this man has some problem. Because urea can change, urine contents also can change. But creatinine is something which is a very reliable number. So there are reasons why creatinine can go up acutely temporarily also. If at all, even for a normal person without any kidney disease, if there's a temporary stress on the system in the form of dehydration or a lot of physical activity, travel and other things, your creatinine can go up. But it will also come back to normal in a few days' time. If you hydrate yourself well and take care, it will come back to normal. So temporarily creatinine going up also is not abnormal. You can go up and come back. This is called as it's called as acute kidney injury that can temporarily happen, but kidney recovers.
Okay. So I just have one of my recent reports. It says you're right. You're said like you said mg per dl zero point 0.7 to 1.3 creatine serum. Now
Yes, yes.
you're saying this if let's say if somebody is at one, like what number is dangerous? You said 1.2 is dangerous or one is okay?
See, what is clearly abnormal is above 1.3. Correct only.
Okay.
Okay, no. But even number like 1.2 and 1.2 above 1.2, which is the upper edge of normal, even that is also not a desirable number. Whenever we want our patient, to have a report, we tell them, okay, 1.25 is okay, but we are waiting for it to reduce below 1.2, preferably below 1. If the kidneys are efficient, they should be below 1. Understood? They're like very safe numbers.
Okay. Got it. And what about the other markers that we have? Things like BUN and I can
Yeah,
see
yeah. See,
so many
we
other
have
things
what,
in the
yes,
report.
we have
Yeah.
what's called as blood urea nitrogen, and also urine also, we do assessment for urine protein, urine glucose, and microscopic cells in the form of, pus cells or white blood cells, RBCs, and look for CAS, and all the cells we see in the urine. So these are all signs again of a kidney disease. In kidney, there are so many diseases that can affect the kidney. In various diseases, various numbers are increased or decreased. So that's why these numbers have a role to play.
Got it. And how does smoking affect any of these functions of the kidneys? Just for audience who smoke, I think it'll be easy to understand for them.
Smoking, no, not about kidneys. Generally, remember, smoking is a affects all the vascular structures, all the microvascular structures. That's why smoking, the people have a heart attack because the blood supply to the heart is cut off. The heart suffers from blood supply loss. Even the legs also, they develop gangrene because the blood flow. At a microscopic level, the blood vessel starts becoming inflamed. Same thing. It leads to microvascular disease of the kidney. That's what it can cause kidney dysfunction. It can cause hypertension. It can cause various things. Not just cancer. It can cause all these things. Structural problems of the vital organ.
So essentially, it's like the blood vessels or capillaries narrowing and blood doesn't flow enough to these
Yes.
parts that causes
Yes.
possible.
Exactly. Exactly.
Okay.
Exactly.
Interesting. Okay. So I also read, since I was doing some research while talking to you, I read something called as a GFR test. I've not heard of it in any of the routine tests that we do, but I read that this is prescribed by the doctor in some cases. What is a GFR test and what symptoms or risk factors would warrant that test?
See, GFR is nothing but when you say GFR, no, it's a glomerular filtration rate. Glomerulus is a part of nephron. Every nephron we're talking about, which is a function unit of the kidney, will have what's called as glomerulus. Glomerulus is the initial thing which takes up the entire kidney, entire blood content, filters things. Some things are required for the body, puts them back. Some things are not required for the body, puts them out, and it's called as filtering. So GFR is a number. It tells us about the global kidney function, overall kidney function. It tells us. So that can be determined by doing the same creatinine. If you do creatinine, indirectly GFR is given. Many labs know if you
Uh,
ask for
uh,
creatinine, they automatically give you the GFR. GFR is calculated number, and GFR is a function of the person's age, the body weight, male or female. Sometimes the race. You take into account African race because everybody will have different requirements. So depending on the age also, GFR varies, and it also varies depending on the body weight, man, woman, and creatinine. So creatinine is the number that gives rise to GFR derivation.
okay, so creatinine is as good as a proxy for this, so you don't need to
Yes,
do.
that's
Okay.
all. Exactly, exactly.
Okay, got it. And you also mentioned sometime back about the reasons for kidney failure as diabetes and hypertension being, let's say, the top two reasons, if I understood you right. Now, is that something then can we extrapolate or extend that people who are slightly obese, or are they, let's say, top targets, or let's say patients of kidney disease? Would that be a fair assumption then?
Yes, yes, definitely, definitely. All these, all these are factors which will, make you prone for kidney problems. Like obesity, body weight, the fitness levels, all those things matter. Yeah, yeah. They're all the proxy to say, okay, whether this man is prone for kidney problems also in the future.
Hmm. Okay, that's interesting. Um you also mentioned about urea and BUN. And what kind of markers? I mean, we understand that creatine is something that we should look for specifically in the blood test. Now, this urea and bun, is that very important for us to see, or is that something that we don't have to worry too much
See,
about? Like, when do you look at
urea,
this versus the other one?
urea and bun are like proxy markers. The basic strong marker is the creatinine. But whenever you do creatinine, you don't want to do it alone. You want to do urea and bun also to make sure that the creatinine, is sort of you can say it's like validated. To validate creatinine,
Hmm.
but to do urea and bun also at the backup, because you can't, don't want to believe on a single parameter, so that you have a backup. In case creatinine lies, you want to check with urea and creatinine. But the most reliable is creatinine only. But yes, the backup markers are urea and the bun.
Okay, backup markers. Got it. Just to substantiate that something is probably
Yes,
off
yes,
charts. Okay, got it.
exactly, exactly.
So one of the things that I've generally read, specifically with all this protein hype that's happening in the market, is that excess protein can damage a kidney. I mean, this is a statement that keeps going on. I want to get your perspective. Excess protein and kidney, is there a correlation? If so, what is it?
See, the thing is, when we know the kidney is a wonderful organ to for you to save your protein, so that the proteins are not lost. So creatinine is, the kidney is meant to save the proteins in such a way that it filters the waste product, at the same time doesn't lose the proteins in the body. So at the same time, whenever, especially people who take more of animal-based diet, who have excess protein in their diet, they tend to strain the kidney. The kidney goes through sort of massive work, because it has to save the valuable proteins at the same time throughout all the unwanted products. So the challenge to the kidney is very higher in a person who's taking high animal based diet, and especially if there's a big protein meal. If you take a protein meal, that protein meal can be a challenge to the kidney.
So the challenge usually comes in terms of how much protein is usually safe versus how much can be potentially overworking the kidneys in this case. It's not like it's damaging, but it makes it work really hard, is what I understand from what you're saying.
Generally, you see, this number has been arrived at by looking at the kidney capacity only. But the average number in which the kidney can easily do its job is, we say that's what, 1 gram per kg per person per day is the consumption. For example, a 70 kg man can take 70 grams protein per day. 1 kg, 1 gram per kg per day is the formula. So that is the max. Okay, no, that's the max. But you can take more, kidney can still manage, that's a different matter. But yes, ideally in the long term, better not to sort of overwork the kidneys.
Okay, now this is going to upset a lot of bodybuilders and gym goers, because the recommendation online, doctor, as you're aware, is start at a minimum of 1.6 and go up to 2.2 per kilogram per day of body weight. Now, is that too much of a load for the kidney, or do you think that's not really required for most
See,
people?
what I say is not just with regard to kidney, generally with regard to the human body also. I think the protein supplements or protein requirement is slightly oversold. In the let's say this one, because we may not need such a high protein load, because humans, as they are designed, our teeth factor, our intestinal length factor, all these are actually designed for plant based diet, and plant based diet is not rich in very protein. Plant based diet, unlike an animal based diet which is very rich in protein, humans are not meant to easily sustain protein based diet for long time, or animal based diet for long time. So I think, two or something is actually oversell. You should not take so much protein. 2 grams per kg per day is, I think, is a bit too much. I
So,
think max. Yes, yes.
So for, let's say, for the gym bros who go regular and eat a lot of protein, would that result in their creatine result being more than one, or kind of go to the north side of it?
Yeah, it is. It is. See, one is the blood parameter itself will start showing those changes. This is about the parameters. Second thing is gradually in the long run, the kidneys are slightly overworked. You know, see, actually, what they say, the other extreme example is, for example, in lions and other animals which consume a massive protein meal after a kill. So their kidneys, interestingly, their GFR and their glomerulus, they work almost 10 to 20 times overwork for those 1 or 2 days when they consume a heavy protein meal. Human kidneys are not designed for such heavy protein meal. So it's a design factor of the body. We are meant to consume more of plant-based diet. Animal-based diet is a bit of an overwork. We can consume, but yes, but you should remember that.
Moderation. Yeah.
Yes, yes,
Yeah. I'm sure this is going to create a lot of chit chat and controversy around people who are on the animal diet. Anyway, that's a different
yes,
matter.
yes, yes.
Yeah. So on the urine test, I think we covered pretty much everything. Trace protein or proteinuria. You said you explained us what it signals and what people should be doing. The only other thing I want to understand is this blood in urine. Sometimes, which you said it can happen, which is a early signal of some issue. When does it happen, and what should people do if they see it?
But, blood in the urine can be because of various reasons. It can be because of kidney dysfunction. It can be because of a tumor, or it can be because of infection. Infection itself can give rise to blood in the urine. Depends on the background that we are looking at. If it's already a person who's having some urinary symptoms in the form of burning sensation or some fever, then you must look for other causes of blood in the urine. But it can also be because of kidney dysfunction. Like the kidney dysfunction is shown up as red blood cells in the urine. So you will see them in the urine report, or patient themselves coming and complaining of blood in the urine. So all these are very certain signs. Yeah, yeah.
Okay, okay, I see that. Okay, in my report, I see something called RBCs nil slash HPF.
Yes,
That's
yes,
the
yes,
one. Okay,
yes, yes.
and then I see something called as pus cells, epithelial cells, cast, and crystals. What are these things?
So the same thing, all these no crystals, again, it tell us about the tendency of any kidney stone formation. Cast will tell us about any excess of red blood cells or white blood cells, because they're all again subtle signs of long-term kidney dysfunction. If you see red blood cell cast, you're thinking about kidney dysfunction, which is developing over a period of time. So they're all very subtle signs to say that okay, this person has this specific kidney dysfunction.
I see. So I think to summarize for people who are looking at kidney function, if they look at creatine, that is good enough, and if the number is kind of inching towards 1.25, 1.3,
Yes,
they should
yes,
basically go to a doctor. And so if they
exactly.
come with if let's say somebody comes with a 1.25, borderline 1.2, close to 1.3 or more, then what do you tell them? Like how do you bring those numbers back?
See, the thing is again depends on the background. Are we looking at a diabetic? Are we looking at a hypertensive, or a person who's exposed to certain chemicals, either starting from smoking, or some industrial thing. Depends on the professional exposure or hydration level. Is he well hydrated? Those kind of things. Especially the commonest scenario we come across is presence of diabetes in the background. We check how is the sugar control. Is the sugar control good? Is he on good drugs? And is his lifestyle good enough? What about his diet, physical activity, those kind of things. So when you focus on these other comorbidities, gradually kidney also starts falling in line. So the stress on the kidney also is lesser. So whenever we know that there is somebody with a marginal kidney dysfunction, you start working on these things. Sometimes some drugs themselves can cause. So therefore you must choose the drugs. Whenever you already know there's a stage one kidney disease, you choose the drugs. You sometimes refer the patient to a physician or to a cardiologist to change his BP drugs or to change his diabetes drugs. What alternatives? What safer alternatives we have got?
So
Eh,
you mentioned a combination of factors. One is the lifestyle reasons, plus I think some drugs that they take that can cause creatine to
Yes,
go up. Correct? Is that right?
yes, 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 yes,
And
yes.
on top of it, is there any, let's say, medication that is given to this patient on top of what he's already having to bring this creatine down, that marker
The
down?
people who have all this in the background, no, there are some drugs which are called as renoprotective drugs. which are meant to, one is regulate the BP. At the same time, they are also extremely protective to the kidney. So those drugs are initiated. But anyway, it's always initiated with the help of physician who's treating the patient's background hypertension. And regular follow-ups are important to see which drug is working for us. Repeat the creatinine in a week's time and see whether things are on the right track. And again, make suitable changes. You must keep making suitable changes. Yeah,
Yeah. You specifically mentioned smokers a few times. So I just want to understand, let's say if somebody is smoking or smoked for a long time, a decade or two, and then he stopped, does the kidney recover to an extent, or is it like, how is it going to behave after that?
See, it depends again. It depends on what stage the kidney disease has reached. So, irrespective of the disease you're talking about, like diabetes, hypertension, smoking, or anything else in the background, irrespective of them, what stage is the kidney disease? That's what matters. Again, see, there is something called as acute kidney injury. There is something called as a chronic kidney disease. The acute kidney injury, by word itself, means that this kidney has a potential for recovery. When we say chronic kidney disease, it already means a label that the person has only this much of reversible kidney function. So again, depends on how long the damage has been happening to the kidney. Also,
Mm.
it depends on what is the age of the patient. Younger patients, longer kidney damage can still recover. Older people, even a single episode of kidney damage, very low chance of kidney recovery. We see the same drugs, which are, for example, painkillers. There's a painkiller which is given for kidney stone problems and the problems. It's very specific to give good relief from pain. Interestingly, if you use them often in an older man, very high chance that he will have permanent kidney dysfunction. Those kidneys will
Oh,
never recover just because he took those painkillers, either with a doctor's supervision or he himself has taken it. So we are there doubly careful when we use those in older people. At the same time, the same painkiller has been, is being consumed regularly by other specific person. He keeps taking it for years together, decades together without any kidney damage. So it depends on the person's background.
so this makes me curious to think that there could be cases where people have firstly taken some medicine not knowing that it could be damaging the kidneys. I mean, is there something that you've seen as a pattern?
Yeah. Not me, Baba. It's a day-to-day affair. We call it as
Oh,
analgesic nephropathy. It's a very, very common day-to-day affair. People, for example, for some sucking a knee pain or some little low back pain, they keep popping painkillers. It's been prescribed to them by their orthopedic doctor or some other physician colleague at some point of time, and they never go back to the doctor. Whenever there's a pain, they take this painkiller and carry on with the day-to-day activity because the pain, they can't tolerate pain, which is totally understandable. And this painkiller gradually causes kidney dysfunction. And this is a well-known
oh,
entity called as analgesic nephropathy. Drug-induced kidney dysfunction, and they're permanent. Those patients end up with dialysis. So
oh my goodness.
yeah. Later you stop the medicine, it's of no use.
Can you just maybe just for the benefit of audience who have tuned in, can you tell us what are these common painkillers that people should be very cautious about and they should double check with the doctors?
See
Some
in
common
the in the
names?
see in the painkiller, no, there are at least 8 to 10 categories of painkillers which can give us to pain relief. Okay, no, but not all of them cause this. For example,
Mm.
one of the safest in kidney disease is crocin or paracetamol or dolo that you can take. That is a very safe painkiller, but it's not a strong painkiller. It's mainly for fever. But other painkillers which can cause kidney dysfunction, which are very useful but can cause a kidney dysfunction, is in the form of diclofenac sodium is what we call, or ibuprofen or brufen we call that. So
Oh,
brufen and Voveron, these are the common company of the medications which can cause kidney dysfunction, or even nimesulide, nice also can cause, and even ketorolac. See, I'll tell you what, they belong to a class called as NSAID. NSAID means
oh.
non-steroidal anti-inflammatory drugs. They are the ones that can cause, kidney dysfunction. But they are very useful. But yes, there's a problem.
Interestingly, doctor, when I was researching for the gut leakage and autoimmune disease, the video that I shared
Okay.
with you,
Yes.
it specifically spoke about the dangers of NSAIDs and gut leakage and the tight
Yes.
junction gaps, saying
Exactly.
it can
Exactly.
actually affect your colon, is what it said.
Interestingly, yes. Definitely.
Wow. Okay, so people should be careful with how do you call it? Chronic NSAID usage, or how do you? What is the term clinically that we can use for this?
Interestingly, the chronic NSAID usage can cause it, which there is no doubt about it. But what I'm also telling is, it's about even single dose, one or two dose also can cause this. People have had this. They say they never used it, doc. Only that day when I came to, I used it. That's all. And you have a documented analgesic nephropathy. That has happened. So therefore, even when the patient comes to the emergency with severe pain for some kidney stone, we always check the background creatinine, we check the background kidney function, overall thing, and then give the injection. When the patient is waiting in emergency because it has happened. People have documented it. It's not a common thing, but this can happen. But yes, the common thing that you mentioned is chronic NSAID usage. People who use painkillers on a regular basis, have a very high propensity for kidney dysfunction.
Got it.
And see, I'll tell you, for example, see about NSAID usage, I'll tell you interestingly, it is not so blind that, okay, it can happen to person with a single dose also, or it may not happen to people for multiple dose also. So there is multiple things in the background, not just the age factor, background factor of diabetes, background factor of whenever somebody takes a painkiller, how is the hydration? Is he hydrating himself well? Is he drinking enough water? Because one of the best cushions for the kidney whenever you take a painkiller and other things is the water intake. Or whenever there's a toxin in the body, how do you hydrate yourself well? If you hydrate yourself well, kidney can still wash them off. So the kidney gets the buffer. Otherwise, kidney goes into an extreme strain to throw out that load.
Got it. So I think this is a very interesting, interesting trivia for a lot of people who don't know how kidney can get affected by usage of NSAIDs. I mean, glad it was not part of my question. It just came across as we spoke.
Nice, nice.
So the other thing I want to ask you, doctor, is you mentioned that of course the alcohol consumption is going to affect liver a lot more, which is understood. Of course, when we grew up, everybody used to joke even in movies that you'll get a kidney failure and people will say, "Oh, I have one more kidney, I can drink, I'll be fine." Now, I still want to understand if at all alcohol affects kidneys, or if there's any safe limit for people who are drinking and thinking that okay, now this is safe, my kidney won't be affected. If at all, if it affects, how does it happen?
See, alcohol affects every part of the body, but the point is, alcohol is not known to directly affect the kidney. But one thing is for sure, there's no safe amount with alcohol. People have realized it gradually. Earlier, we used to say, red wine, or specifically this kind of category, this much percentage is safer. People used to say. Now, of late, articles have been coming bombarding that no amount of alcohol and no type of alcohol has been found to be safe. That conclusion has already come recently. It has come. So therefore, there's no justification to say, okay, this much alcohol is permissible, is safer. We cannot say as doctors. Okay, no. So it's better to quit alcohol to whatever extent it is. But yes, once in a while, alcohol consumption is not known to cause any major dysfunction. Okay, no. That's what it is. But no amount of alcohol is considered safe at all. If you ask me medically, no amount of alcohol is considered safe. See, the mechanism is, the very chemical in the alcohol can cause system damage, especially the kidney vascular thingy, because ultimately it comes to the blood vessels. Blood vessels get affected everywhere in the body, including the kidney vessels get affected by long term alcohol consumption. So that's how the kidney goes into failure.
So similar to how smoking constricts the blood
Yes,
vessel, alcohol
yes.
has a similar effect.
So smoking is more obvious, more drastic. Alcohol is more subtle. Yeah, it takes
Most
takes a while. Yeah,
takes long. Okay, longer
longer
time.
time.
Okay, got
Yeah,
it.
yes.
Okay, great. Now this kind of clarifies that the effect of alcohol on kidney is much smaller than smoking. What are the other lifestyle habits that can, like, I don't know if it's sleep, stress, sedentary, or obese, high salt intake, or whatever intake. What are the other things that can potentially damage kidneys? Because we already discussed about the top reasons people get kidney failure: diabetes and hypertension, and we know the root causes for that. What are the other lifestyle factors that people should keep in mind?
So this is what we're talking actually is a very general, so to say, sort of healthy lifestyle. For example, we cannot say the number of hours of sleep, for a decent, 6 to 7 hours or 6 to 8 hours, depends on, on you and your personality and what is your day, how does the day look like? Is it a strenuous day and all that, depending on that. So adequate sleep is important. Adequate hydration is important. Hydration, when we say, I think last time we discussed, urine should almost look like water. Mild yellow tint is okay. Don't allow it to become dark yellow. That means your entire body has received a good amount of hydration. And your food should contain mainly water-rich diet, especially plant-based diet, especially lots of raw fruits and raw vegetables. Plenty of fruits and vegetables sufficient to produce at least 1.5 to 2 liters of urine in 24 hours. So that's what is meant to keep the kidney safe. And fluid intake, fruits intake should be sufficient towards that end. And raw fruits, raw vegetables especially helps you in keeping the kidneys healthy. Yeah,
Okay. So if people can maintain a basic lifestyle, they can live comfortably with good kidney function till they finally
yeah.
pass away.
Yes,
They don't
yes,
have to
yes.
worry about it.
True.
Got it. I think we are coming to the fag end of session number 1 on kidneys. Just a couple of questions on chronic stage, the CKD stage that you spoke about. So, what are the just give us a brief overview of CKD stages and what happens during each stage.
See, actually, these are just graded, discussion. For example, when we say, CKD, it is based on the GFR. Normal GFR, glomerular filtration rate, is more than 90. It's called as milliliter per minute. That much fluid should be filtered by the kidneys per minute. So more than 90 is considered normal. Less than 89 is considered as, stage 1 kidney disease. Up to 75 or 60 is considered as stage 1 and stage 2. Beyond that, up to 30 is stage 3. Beyond 30, means, less than 30 ml per minute is considered as stage 4, stage 5 kidney disease. So you can see that the overall person's, ability to thrive, his day-to-day activity has come down, his urine output has come down. He starts developing intercurrent infections because the moment the kidneys are affected, gradually your body's immunity drops. The overall performance status comes down. So you can see a lot of other changes happening in the body, skin level, the breathing, everything you can see those changes. So it means, the moment the patient reaches stage 4 kidney disease, is the time to think of what's called a renal replacement option. What are the ways to replace the kidney, either with a dialysis or by kidney transplant? Dialysis, again, there are two forms. One is called as hemodialysis, second is called as peritoneal dialysis. Depending on the affordability and the facility and lifestyle the person has, you can choose one form of either of dialysis.
This looks, I mean, for someone who's been used to urinating whole life, suddenly the fact that it stops must be extremely uncomfortable
Extremely
psychologically.
uncomfortable. Exactly, very true. Very, very unsettling that he's not passed a drop of urine from morning and he doesn't have much in the bladder to pass. But interestingly, it's also a fact that, these patients are told that, you should not take more than 500 ml of water in 24 hours. You cannot drink more than that. You cannot drink coffee, you cannot drink water, you cannot drink liquids beyond all the fluids put together should be 500 ml or 700 ml, they say.
Oh,
Because, because kidneys cannot do the job, though they have to go for dialysis. But the 24 hours, the body cannot tolerate that much fluid load. Even 500 ml, they can't tolerate. So therefore, fluid restriction. He can eat everything, but he cannot drink water.
so that's a very severe lifestyle change, which is difficult to adjust to, right? Hmm.
Yes, definitely.
I'm pretty much done with all the questions related to kidney, Dr. Srinivas. I think this brings us to a nice logical end where in the next session I'll go deep into the bladder basics, the signaling,
Sure, sir.
and the way I think we've spent 55 beautiful minutes understanding the basics of kidneys, what factors affect it, what factors will keep it healthy. I hope this has been very useful for the audience as much as it was useful for me. Dr. Srinivas, thank you once again. I'll connect with you soon for the session into bladder, and then we'll go into men's and women's health, specifically on urology. Thank you so much.
Sure, sure. Looking forward to. Thank you. Thank you so much.
Thank you.
Bye bye.
Bye bye.
Thank you. Bye bye.